few weeks ago, we met Sharon, a woman so scared of going to see her doctor, she avoided her checkup for over 6 years. Have a look.
When's the last time you had a pap smear?
Probably about 6 years ago. I just can't bring myself to go.
You don't
I
want
don't want to know.
Right.
I don't want to know. I'm happy living oblivious with it.
This is about prevention and being able to deal with the problem so Dr. Lisa can help you stay healthy.
You need to take control. You don't want to wait till there's something bad happen and you can't do anything about it. You have to want it. So if I said that I'm all set up to do a pap smear.
Right now?
Yeah.
Okay.
Okay.
Oh.
Okay. Ready?
So are you reliving that moment?
Yes. You know, you got me through the last time I was on here. I couldn't have done it without you. And I appreciate everything that you did. And just, it's really terrifying, you know, because you're so scared. You're so scared to be able to go and find out, you know, you don't want to hear the bad news, but you know something's going on, so you know that you have to, but the fear of finding out is so great.
But what you really need to fear is not knowing. And so now, and I know, Dr. Lisa, you're going to share some of this information with everyone. Now, at least you know.
Right, because you were having pain, right? You want to tell us about the pain that you were experiencing?
I have, and it's been getting, you know, worse and worse and worse throughout the years. You know, I have severe, like, pelvic pain to the point where, you know, it almost feels like my, ovary or something is going to explode. I mean, it's crushing pain.
So when she came to my office, we did cultures because you want to rule out certain things. We did, like infection, we did cultures, and I'm happy to tell you those came back negative.
Good.
And we did an ultrasound, and you know, she had just normal cysts on her ovaries, but they were normal. They weren't anything abnormal, just functional from ovulating. And so we ruled out any irregular cysts that could cause pain, any pelvic inflammatory disease or abscesses that could cause pain, or fibroids. So all these things we were ruling out. And the reason I say that is because there's some things you cannot do on exam or see, and you kind of, by the history, by the exam, you kind of elicit a diagnosis. And her pap smear, her cultures, everything we did came back negative, but she clearly had pain on exam. And this kind of pain was consistent with something we called endometriosis. And what endometriosis is when the endometrium, or the lining of the uterus, actually implants outside in the pelvis. And it can be on the tubes, it can be in the pelvic sidewalls, it can be on the ovaries. And basically, it releases the same prostaglandins that happen with contractions in the uterus and causes pelvic pain during certain times of the cycle. It can also cause pelvic pain with deep penetration on intercourse, and just really painful periods. And this was very consistent. What happens is you get these little red, or what we call gunpowder lesions that we see in the laparoscopic procedure, that they're kind of implanted all around anywhere. They can be implanted on the bladder even, or the rectum, anywhere in the pelvis, and cause a lot of pain. So what we try and do is see if we can treat these without having to go to surgery. We can either do that with birth control pills, progesterone injections, progesterone IUDs or intrauterine devices, and also something called GnRH agonist, which is called Lupron, which we were thinking about trying in you. Right. One of the reasons we can't do birth controls with you is because you smoke, right?
Yes.
And just to clarify for everyone watching, the reason that a woman who smokes cannot go on these hormone options is because the risk of a blood clot is greatly increased, whether it's a blood clot in your legs or a deadly blood clot in your lungs.
So we're going to get you to stop smoking. But if not, laparoscopic surgery may be the only option for treatment.